On the 17th of September, the world marked the International Day for Patient Safety, a day that focuses on initiatives that ensure the safety of patients in healthcare systems around the world. Kenya continues to fall short of the acceptable standards, with the country's healthcare services being at an all-time low this past week. This is exemplified by an online video showing a woman recently giving birth outside Pumwani Maternity Hospital gate as she was denied entry. NTV's Charity Mwangi was at the hospital to get some answers.
Sunday, 13th September, a woman whose identity will remain protected, crying for help just outside the Pumwani Hospital in Nairobi. She had arrived on time just before giving birth, but she was not allowed in. Reason: there is a go-slow at this hospital as part of the ongoing medical workers' strike that has caused a crisis in Nairobi. This is one such despicable example of the crisis, as the woman had no option and the birth of this innocent human couldn't wait. It started on the sun-scorched road just at the gate of this hospital, what is meant to be a private affair in a safe environment, happening in full glare of a shocked and confused public. Hours after this video circulated online, it drew outrage. In surprising dissonance to the response, the Nairobi women representative had a different perspective of things. She claims that the hospital service has been above reproach, even during the strike.
So the lady received treatment. Her baby was already out by the time the nurses got to her. She gave birth already, and it's happened. We've seen roadside deliveries. You can be heading to hospital and you deliver along the way. And you can't deliver in a car, you have to get out of the car.
She further faulted the public for causing a scene outside the hospital and delayed assistance to the woman.
The public were actually crowding the area and making a lot of noise, making the few nursing staff that were in the hospital were actually feeling scared to come out in case of being lynched.
Besides the view held by the Nairobi women representative, the Nairobi Metropolitan Services was quick to give what it termed as eyewitness accounts on the whole ordeal. The NMS issued a statement claiming that the guards at the gate are responsible for the unfortunate incident. It further held that the Pumwani Hospital nurses were quick to respond to the woman's cry and deliver the baby, an account refuted by those who were present, among them Christine Gaki, who is credited for helping deliver the baby.
Na nikaambia mama alale na nikamzarisha vizuri sana, nikamwambia push, and she pushed, na mtoto akazaliwa, mtoto wa kike. Mama alikuwa kando yangu, nikamwambia tafute scalpel na kamba. Venye alienda kutafuta scalpel na kamba, bwana huyo bibi ndiye alikuja akatangulia na madaktari kutoka hospitali ile nyingine, ndo akakuja wakasaidia huyo mtoto.
Huyu haitwi Mudheo, huyu sio professional nurse. Kwa hivyo hiyo press conference walikuwa wamepeana ya kwamba nasi yule alifanya delivery ni wa Pumwani, anaitwa Mudheo, ni ya uongo.
The ongoing Nairobi health workers go-slow has severely affected services at the hospital that is operating on a very lean team.
Manasas walikuwa nasema wengine waende Mama Lucy, wengine waende Kenyatta.
Kwa nini?
Juu wakuwa wanafanya kazi.
We don't want to go after the askaris at the gate. Askaris at the gate operate under instructions. We want to go for who gave askaris at the gate instructions to close the gate and prevent mothers from entering.
When it comes to maternal health, it is an essential service that cannot be compromised. Whether doctors are on strike or not, it is a service that should be given.
Mama, hata kama ni mama tajiri ama mama fukara, mama ni mama. Ama sio? Mama ni mama na apewe heshima. Let us consider having a health services commission so that matters of health care staff personnel is handled centrally, just like the matter of teachers is handled centrally.
Similar sentiments have been echoed by the civil society that continues to advocate for dignity in the sexual reproductive health services offered to Kenyans.
We will not hesitate as FIDA to sue anyone and everyone who was accountable at different levels on this matter.
When government fails to meet its end of the bargain, it is the vulnerable and the sick who suffer. Unfortunately, the uncertainty of the resumption of services in most hospitals lingers on, with anxiety and fear in tow. Charity Mwangi, NTV.